Good evening and welcome to IHW Council's special web series on women's health, START, supporting treatment in assisted reproductive therapy. I'm Anisha Nair Dhawan, your host for the day, and you're watching our exclusive show on women's health supported by Bharat Serums and Vaccines under its public awareness initiative. The COVID 19 pandemic has put the spotlight squarely on our health. The arrival of the vaccine and the start of the inoculation process has brought hope to millions of people who want to stay safe and return back to their pre corona days. But there are many who find themselves in despair as some of their dreams have suffered a setback because of the many restrictions of the lockdown and the fear about COVID 19. I'm talking about those couples who dream about starting their family but are unable to do so because of infertility. Infertility over the years has emerged as one of the most common health issues that many young couples have been facing. According to the Indian Society of Assisted Reproduction, infertility currently affects about 10 to 14% of the Indian population. The scenario is worse in our cities, where one out of every six couples is impacted. Our show today is special as we are going to discuss all aspects related to fertility and IVF treatment. Bharat Serum and Vaccines Project START is an initiative that aims at providing support to couples beyond medicines with initiatives like microfinancing and treatment and counseling. Project START encourages couples to stay on the course for IVF treatments to achieve their goal of parenthood. Today, we will be discussing dealing with pregnancy after infertility treatment. The new battle begins. There may be questions in your mind on what you should do to succeed in starting a family on our show. We have an expert joining us to help answer all your queries. Please welcome Dr. Purnima Durga, fertility expert and medical director, Mom IVF Hyderabad. Welcome to the show, Dr. Durga.
Thank you so very much, Anisha. Thank you.
Before I begin our conversation, I would like to request all our viewers who are watching this show to keep sending us your questions in the comment box. This is your golden opportunity to get all your questions answered by an expert over the next 30 minutes. And also like and comment with your feedback. Do share this special page on your wall, or if you find it will be useful for your friends or family, do share it with them as well. So let's begin, Dr. Durga. Now, a pregnancy after infertility treatment, be it IVF or otherwise, is very special because you really, the mother and the parents really waited for it, and some of them have even struggled for it. So, this special pregnancy, is it different from a normal pregnancy?
Uh, yes, it's not different from the normal pregnancy, but the process they go through to achieve that pregnancy is bit stressful for the couples. See, generally, one in 8 to 9 couples conceive within 1 year of their married life. So the around 20% of the couples need some form of help in form of treatment to achieve pregnancy. So basically, treatment for infertility is bit a stressful process for the couples because they have to go through number of scans, follicular scans, medications for the follicle egg to develop, and all those stuff, all those uh, all those things. And on the part, the success rates of any fertility treatments are not 100%. See, it depends on a lot of other factors. Depends on the age of the female, the male parameters, and the cause of infertility and all. Even though the couple, it's not that the couple come for treatment and they go with a pregnancy in the first cycle. So they have to go through number of cycles depending on the profile of the patient. So it's definitely a stressful process for the couples. Once they get pregnant, then the actual anxiety of the couples even more increase. I've seen a lot of patients even after normal pregnancies, like normal ovulation induction, simple ovulation inductions with timed intercourse couples also, they will be so anxious. Even a slight bit of headache or nausea, which is very common in pregnancy, or mild cramp in their abdomen, also they will be so anxious and worried, and they keep calling me that, is this normal, is this normal? So definitely it's not the pregnancy is not that different from the normal, but the process they go through, the efforts they keep to become pregnant, that is very stressful for the couples. That causes anxiety and think that it's not a normal pregnancy compared, but it's not like that. It's almost like a normal pregnancy, except in IVF conceptions, where we need to use lot of medications for the luteal support for the first 3 months for the support of the pregnancy. Otherwise, the normal timed intercourse, ovulation inductions, and the IUI cycles are pretty normal as a normal pregnancy. Yeah, Anisha.
So, Dr. Durga, then why is there this impression that most pregnancies after infertility treatment, especially IVF, are complicated ones? Now, what was happening previously was there were usually multiple embryos that fertilized and then developed. So there were twins or even triplets that the mother conceived and carried till term. So not only were there multiple babies growing, plus it is believed that you should not take stress, you should not work, you should take extra rest once you conceive after IVF. Is this really required?
Yes, in IVF pregnancies, they go through a process, like they have to go for the ovulation in stimulation for 10 to 12 days, then they go for an oocyte pickup, they have to undergo a small surgery for the egg retrieval, then we fertilize the eggs with the sperm in our lab, that's called ICSI, then the embryos were formed, and then we transfer back. Generally, previously, in previous days, they used to transfer at least 2 to 3 embryos. Now, after the advancement of the embryology work and the lab, after improving the lab qualities and all, now we are going for only single embryo transfers. As you mentioned, twin pregnancy is always a, a complicated pregnancy compared to a singleton baby, right? See, twin pregnancies, there is a high risk of preterm deliveries, there is a risk of premature abortions and all those stuff. So definitely now, if the embryo quality is very good, we in our center are going for single blast transfers. Yes, IVF pregnancies, lot of people think that it's not a normal pregnancy and they need to take lot of rest. But here the concern, as I already told you, is the medication part. It's IVF pregnancy is that we are creating the embryos in the lab and transferring into her uterus. There are no natural hormones in our body. We have to support from externally till the placenta takes over the function of providing food to the fetus. IVF pregnancies where there are bit of more medications for the patient, and they are also more concerned, worried during that period of 8 to 10 weeks till the first viability scan is over. So in that way, uh, IVF pregnancies are a bit different from the normal pregnancy, and they have to be a bit more careful for the first 8 to 10 weeks. After 10 weeks, I think it's almost pretty as much as a normal pregnancy once the placenta take over the function of providing food for the baby or whatsoever. So yes,
So,
converting to a single blast transfer is much better than transferring to. It's always better to give a single healthy baby than giving two premature
multiple.
babies, right?
Yes, so this must be the new way of doing things because now you have HC and better technologies, better lab facilities to go for one blastocyst. So would you say that it is an overgeneralization to say that if a woman has conceived via IVF, that she should be strict about taking the stairs, getting more rest? This is really not necessary. Is this what you
No,
say?
no, not necessary at all. They can move normally, they can work normally. Only generally we advise rest for 1 or 2 days post the embryo transfer because they'll be so anxious. The
Hmm.
female will be so. Otherwise, there is absolutely no indication, no studies that suggest that rest will improve the success rates in IVF
Okay. Okay, so
transfers.
it's not
So yeah,
scientifically proven that rest helps.
that's not
You
scientifically proven. Yeah.
okay? So what you're saying is that the first 12 weeks are the most critical, whereas an IVF doctor
Yeah.
will monitor the pregnancy. Does it also involve greater monitoring, more visits to the doctor in those 12 weeks?
Yeah, actually, yes, we monitor every 2 weeks. Okay, initially, if the couple conceives through IVF, once the beta HCG is positive, generally we monitor every 2 weeks, fetal growth. But once they reach 10 to 12 weeks, it's only monthly visits. So
Okay.
definitely the monitoring is more intense in initial 10 to 12 weeks compared to the later half, the second trimester. Yes.
All right.
They need to come more frequently to the, yeah.
And after the placenta takes over, we can safely say that you can behave like any pregnant woman and not worry. You will get morning sickness, you will have discomfort, you will have problems waking up at night, but it's all normal, right? Nothing to be stressed about.
Yes, yes. Mostly. See, they are, as you mentioned, if it is a multiple gestation, multiple pregnancies, yes, we need to be definitely more careful comparative to cervical incompetence. We say we need to, they might need a cervical stitch or something. So if it is a multiple gestation, you need to be a bit more monitored. And the other point is, mostly infertile couples who come to us come with a pre-existing like PCO or like a bit obesity and all those stuff. So diet is always to be maintained throughout pregnancy, whatever pregnancy it might be. So there is a more risk of getting gestational diabetes and all those things in the second trimester. In general, risk for any pregnancy, either it is a normal pregnancy or IVF pregnancy. Not much after in your second trimester. It's mostly the first trimester which we need to monitor
Okay.
more carefully. Right.
All right, Dr. Durga, we've already started getting a lot of questions. So let's start taking up some of the questions that are coming from our viewers. A Facebook user is asking, is it advisable or possible to go for IVF at the age of 42?
Yes, actually, IVF, as I told you, it's not a 100% guarantee procedure. Okay, it depends on a lot of factors. The most important thing is the age of the female. Okay, as the age advances, the female age advances, the fertility rates will definitely come down. But it doesn't mean that they can't conceive, but definitely there are other options as well. I can say it depends on the egg reserve, the ovarian reserve, what she's having, and other factor, how is the uterus and all those things. But I can say at the age of 42, if we are going for any IVF cycle, the results will be around 10 to 20% only, definitely. So that we have to keep it in our mind and then try. It doesn't mean that we didn't see any pregnancies at that age, but still the definitely success rates comparatively are much less at above 40 years of age comparative to below 40 years. So,
All right.
and the other part is we have other options as well for IVF where we can replace a gene, we can replace a oocyte with a donor oocyte or something. If we're keen for pregnancy, we can always replace the oocyte and go for other methods as well. That is also an option.
All right. We have another question that is coming from a Facebook user. The question is from a lady. She's saying, I got my left tube dealing from the uterus due to hydrocephalus, and now the left side of the lower abdomen is paining after 14 days of surgery. So, what could be the reason?
She's saying that the left side is paining.
Yeah, she's saying that I think she got the delinking or the left tube done because of
That's fine. That she had
hydrocephalus.
a tube delinking done because of the hydrosalpingo.
Yeah,
Yeah.
so 14 days have passed and she's experiencing pain. What could be the reason? What should she do?
See, generally, hydrosalpingo itself is the infection in the tube. When we see a hydrosalpingo, we just generally dealing the tube and then go for IVF cycles. Mostly, the pain might be some surgical related pain, might be some other infections or something. Which you can go for a scan. You can go for one more ultrasound, ultrasonography, and then check. But nothing that significant once the hydrosalpingo is removed as such.
All right. Let's move on to another question that is coming from a user, Facebook user, who's asking, I have low AMH levels. Does it mean my egg quality is poor?
Yes, actually, AMH is a test which tells us about the number of the follicles that the woman is having or retaining, and also tells about the quality of the oocyte, right? So when the AMH levels are low, it also depends. See, there are two categories where you can consider low AMH with the younger age group, low AMH, older age group. The results are very good with a low AMH levels with the younger age group comparative to low AMH with the younger age, older age group. Got it? So age is a very important factor which tells about the quality. Quality is directly proportional to the age of the female. And AMH tells about the ovarian reserve, number of follicles the woman is left with. So it doesn't mean that low AMH doesn't give pregnancies, but definitely it's better as early she goes to fertility treatment, the results are much better.
No, but the question is actually not about the quantity. The question is about the quality of eggs.
That's what I'm
Does
trying
it?
to do. Age is very important. If the woman with low AMH is having a younger, is in the younger age group, the quality of eggs will be much better.
Okay, so it's not just the AMH number, but your age as well
Yeah.
that determines the
Yes, we need to
quality.
take it age and AMH together.
All right.
So,
Dr. Ulka, we have another question coming in from a user saying, how many attempts does it take for IVF to be most successful? Now, you have been talking about, doing single blastocyst transfer. Now, you must be really convinced that this is going to work for you to, spend an entire cycle transferring just one blastocyst. Has the success rate improved over the last few years? And statistically, how many cycles does it take to be successful with IVF?
see, it depends again on a lot of factors. Again, as I mentioned, it's not the IVF cycle success rate. It depends on the couple history. The most important thing. A lot of people come to me like if some patient just walk in with to my clinic with a male factor infertility, like a low sperm count, the female being normal, everything, and couple, the results will be very good in these patients. But at the same time, as you mentioned, a 42-year-old comes with comes for IVF, definitely the results will be different. So how many attempts depends on lot of factors like the age of the female, the male factors, the cause of infertility, and any previous treatment history they have undergone. The overall success rate we can say is around 40%, 40 to 50%, and the maximum success rates you can achieve in the first 2 to 3 cycles, depending on the see, it's always like a previous treatment cycle will always give you an idea what how you can go in the present cycle. So overall success rate is around 40 to 50%, I can say.
All right, 40 to 50% is the overall success rate. I think
Yeah,
that's an
but then it
improvement
depends
because
again on the parameters as well, age
of
of the
age
female.
and the quality of God.
It depends. Age again, Anisha, I'm insisting on the age. Why I'm insisting on the age? Because as early as you decide for IVF, the results are much better. Age is
Okay.
one determining factor which tells you about your success rate. So if a couple is really want to come for IVF, if they're coming bit early, they know that they have to come for IVF, but there are some people, lot of people postpone it, like they wait. That gives a decreased success rate. That's one point I want to emphasize today. That age is a very important factor for the success rates in IVF cycles, especially the
All right.
female age.
All right. Another user is asking, can a woman get pregnant through IVF if both fallopian tubes are blocked?
Yeah, definitely. It's one of the indications for IVF is a blocked fallopian tubes. Okay, so
So
it's
you're
one of the
saying if a
main
woman,
indication, direct
yeah.
indication for IVF. Why?
So you're
Because
saying
in
if,
IVF there is no relation with the tube. It's directly we are stimulating the ovary, taking out the eggs from the ovary and ejecting the sperm, making a baby. So one of the main indications for IVF is blocked tube. Yeah, definitely.
you would say that a woman who has both fallopian tubes has no option but to go for IVF, right? There is. very little chance that she becomes pregnant by any other
Yes,
means.
yes. You can no. You can also try this laparoscopic tubal cannulation is one of the methods where a small blocks like flimsy adhesions or small blocks can be cleared through laparoscopic tubal cannulations. In laparoscopy also, if you couldn't clear the tube and it's blocked on laparoscopy, then yeah, definitely IVF will be the option.
Right. We have another question which is coming in from a Facebook user. I have right tube block and I have PCOD. Do I need to go for IVF or are there other treatment options that could be recommended?
No. One tube block doesn't need IVF. Okay, we have
Okay.
a woman has two fallopian tubes. Okay, so if one tube is blocked, still you can try normally or IUI or some other um, normal form of treatment than going for directly for IVF. So one tube block doesn't mean that you need to go for IVF. First, if the block is through HSG, generally basically for tubal evaluation, we do a X-ray that is called HSG to see whether tubes are open or blocked. But in HSG, if the tube is blocked, there is always you can go for a laparoscopy to confirm whether it is a proper block or sometimes pain will also cause spasm of the tube. So you can first confirm, go for laparoscopy, confirm whether it's a real block or not. And one tube block doesn't mean IVF at all. So you can always try the minor treatments like ovulation induction. So,
Okay. And what about the PCOD? Do you think that it needs proper treatment before you begin fertility treatment? Is it part of fertility treatment? Does it impair the success rate? What about PCOD also?
yes, PCO is one of the most common problem women come with fertility clinic, especially whoever comes to the 80% of the gynecologists deal with PCO patients, especially infertility patients. The most common thing is how to correct PCO is a lifestyle modification. Even though a lot of people come for IVF with PCO, ask them to lose weight and then come for IVF. So it's the lifestyle modifications which improve the PCO condition or improve the quality of eggs. So losing weight, maintaining proper diet, and regarding the drugs, we have certain medications. PCO, what happens in PCO basically? Basically, there won't be a proper egg release in PCO patients, so such that their periods are irregular. Generally, every woman have a 28-day menstrual cycle. In those patients with PCO, the periods are very irregular because of irregular ovulation. Egg is not formed properly and it is not released on proper time. So, how can we correct it? The most important thing is lifestyle modifications like losing weight, proper diet. Still, there is no, if the, some patients are thin PCOs as well. In those cases, they might need a bit of medication for the egg to develop, and then it's not, you can correct. And there is another method where you can always do a laparoscopic correction of PCO also. It's a
Mhm.
other method
So, what
apart
is
from
this
it.
laparoscopic correction of PCOD?
See, basically, what happens in PCO, the ovaries are very bulky. Okay, and there are more of male hormones than the female hormones in PCO. That is the reason, and they don't develop into a mature egg. So that's the reason some people will have excess hair growth, some people will have baldness with PCO. This is all because of the excessive male hormones, which are more than the required in a female. So in laparoscopy, what we do is the ovary is very bulky in piece. We do a laparoscopic ovarian drilling with a current. So that drills the cortex, that drills the ovary, where they say that the hormonal imbalance is corrected and the ovulation is much better. That's how we correct PCO in laparoscopy.
All right. We have one more question that is coming in, which is: are there any side effects of IVF treatment?
Side effects? No, not much, nothing. A lot of people ask me, but basically one or two ovarian stimulations doesn't cause any side effects. But as I told you, the medication part is bit sometimes painful for the patient. Like sometimes we give injectables It might be more safe. Some people think that pre-medication part is difficult actually to maintain the pregnancy, the medications we give. Otherwise, it's not much, no side effects, no complications, pretty safe procedure. We have a lot of, previously they used to have a risk of hyperstimulation during IVF treatments. Now they have a lot of, we have freezing techniques where there is no need to transfer in the same cycle. It's very safe and safe procedure with very, I can say no side effects at all.
All right, so side effects are minimized, and things have improved over the years. Dr. Durga, can you tell us what is this mini IVF? This new trend that is started called mini IVF.
Mini IVF is like, in a conventional IVF, we give medications continuously for 10 to 12 days. Every day, the patient should come to the hospital, take the shot, and it goes for 10 to 12 days, then the pickup and all this. Mini IVF is something where we combine the oral drugs along with injectables, and it's like a, like we stimulate the ovary, not in a conventional way. We are not aiming for more and more eggs. It's like a, we're aiming for less number of eggs with better quality. So the procedure is less complicated. We give minimal injections along with oral drugs. It's not like a conventional IVF cycle.
But do you also transfer the embryo in the same cycle, or do you freeze and then transfer in the next
It depends.
cycle?
Yeah, it depends. Generally, I go for all freeze all cycles. I don't transfer in the same cycle. I definitely maximum 90% of all my cycles are freeze all cycles. So only 10% where the embryos were not well formed, or the quality of embryos is not good, or the freezing is not worth, I consult the patient and tell them that it's better we transfer the embryos and transfer. Otherwise, 90% of all my cycles are frozen
All right,
cycles.
Dr. Durga, I'll take one last word from your
Yeah,
side. Since you handle so many IVF cases and you're a specialist, and doctors recommend the patients come to you when they struggle with conceiving. So you've told us that IVF pregnancies are fairly similar to regular pregnancies after the critical 12 weeks have passed. So, what would you say to your IVF patients or patients who have just gone for an IVF cycle, on what they can do to relax or to by themselves, if there's any way they can increase the chance of success? Would there be diet tips? Would there be stress relief tips? Would you recommend yoga? Do you have to do and to not do that you give to your patients soon after IVF transfer?
yeah. See, the first and foremost thing is, I believe in talking with the patient, right? I don't give these papers, do this, do's, don'ts, what are the do's and don'ts after IVF, what are this. I don't believe in papers, but I believe in talking. I counsel my patient, I sit with them, talk with them, answer all their queries. See, that if you give that comfort and that confidence to the patient, I feel in a one-to-one connect with the patient. I I see my patient from the history till the embryo transfer. I'm the one who is dealing with the patient. So they are there with. So I like that way. Even though I have assistant, I feel that the patient should connect with me. The first visit is the visit where you connect with the patient. I try to answer all my queries. Yeah, definitely we give a diet chart. Diet chart is very, very important because they have a lot of medications as well. Sometimes they might be acidity, sometimes they might have nausea. So all these things, some people complain of constipation because of too many medications. Diet is very, very important after IVF. As you mentioned, relaxation therapies, all these things, yeah, do matter. But the what I feel is the success for my IVF cycles is the one-to-one connect with the patient. If you give confidence to the patient, if you explain them each and every step, this is the embryo. Your embryo is very good. Your endometrium is very good. Definitely, maximum. If the endometrium is good, embryo is good. 80% of the couples will conceive in that. 80%, maybe 20% are unexplained. We don't know. But if you explain them each and every process, you can reduce the anxiety in that couple. You have to be with them, explain them very clearly. Then I think we can reduce the anxiety. Apart from, yeah, medication, Medication, all these things do have an effect. But once the doctor talks with them, explains them thoroughly, half the anxiety of the patients is gone. That's what I observe. So I try to talk with them. Even though if it is a negative cycle also, I try to sit with them and talk with them, reduce the anxiety and ask, explain them what went wrong. So yes, other, yes, obviously that food, meditation, yoga, yes, all these factors are always there. But this is the thing I believe in and I practice.
All right. Thank you so much, Dr. Durga, for joining us this evening and sharing with us your tips on IVF treatment, on infertility treatment, on success rates, and what patients can do to improve the chances that they have. Thank you so much for joining us.
Thank you, Anisha. Pleasure is mine. Thank you. Bye.
So that was Dr. Purnima Durga answering your questions on fertility and IVF treatment during COVID-19. If you have more questions, you can send them to us using our WhatsApp tab. You can just click on the WhatsApp button on our page. And don't forget to follow us to stay updated on all that concerns your health and well-being. This program was supported by Bharat Serums and Vaccines Limited under its Public Awareness Initiative. We'll be back with another special show on women's healthcare the same time next week. Do follow us on Facebook, get all the updates on our upcoming programs. Keep sending us your questions. We'll certainly include them in our next show. Till then, stay at home, take care, goodbye, and see you soon.